Hello, my name is Firas Kayed, and I will be talking to you about cardiac catheterization that has been recommended for you by your healthcare provider due to your results of your stress test. Catheterization is a procedure used to diagnose and treat various forms of heart and vascular disease. The procedure is performed in an area of the hospital called the Catheterization Laboratory or Cath Lab. Most procedures take between 1 to 4 hours to complete, and you will need to stay in the hospital for up to 8 hours after the procedure, or in some cases overnight, to be monitored before going home. You are having a catheterization because your doctor knows or suspects that you are having cardiovascular disease affecting your heart or blood vessels or both. Catheterization is used to diagnose or treat various heart or vascular conditions. The most common type of heart disease for which catheterization is performed is coronary artery disease. This is a condition in which plaque buildup within the arteries that supply blood to the heart muscle. Because your procedure has been scheduled for tomorrow, it is important to let me know of any kidney problems or allergies, what medications you take along with dosage information. We would also need to know of any vitamins or herbal remedies. You are also not allowed to eat or drink anything after midnight due to the effects it may have on sedation. Your cath lab team consists of an attending physician who is an experienced cardiologist and will be performing your procedure, a fellow who is a doctor who is pursuing further training in cardiology, a physician's assistant that is a healthcare provider who has been specially trained to assist the attending physician, a nurse who is responsible for completing an assessment prior to your procedure, and finally a cath lab tech whose role is to set up and operate the various types of equipment used by the physicians during the cath procedure. Once in the procedure room, ECG leads will be attached to your chest to monitor your heart rate and rhythm. The selected areas for insertion of the catheters will be shaved and washed with an antiseptic to ensure that they are clean. The most common entry site is your right groin, but occasionally the left groin, neck, arm, or wrist may be used. You will be given sedative and pain medications through your IV. The doctor will be taking pictures of arteries and veins. To accomplish this, the doctor will manually inject dye through a catheter into the artery that supplies blood to the heart muscle. Cameras will move around your chest, and the table will move so the dye can be followed as it travels through the vessels. A catheter may be placed into your heart's main pumping chamber. This time, dye will be injected by a machine. Moving pictures will evaluate how the pumping chamber functions. The dye causes a hot flushed feeling throughout your body lasting 10 to 20 seconds. What happens next depends. After all measurements are taken and images obtained, the doctor will discuss the findings with you and present options for further treatment. Your diagnosis may lead to a balloon angioplasty with or without stenting, which is used to open a narrow artery in or near your heart. Your repair of any heart defects. If your doctor is closing a hole in your heart, a device is inserted into your heart to close the hole. In cases of heart valve leak repair, a clip or a plug may be used to stop the leak. A procedure called balloon valvoplasty may be done to open up narrow heart valves. A catheter is threaded across the valve. A balloon is then blown up to make the valve open more easily. Valve replacement is a procedure is similar to balloon valvoplasty, except that an artificial valve will be implanted in your heart to replace a leaky or narrow heart valve. And finally, a heart ablation may be done. In this procedure, you'll usually have multiple catheters placed in the arteries and veins of your groin or neck so that radiofrequency energy can be directed to the part of your heart causing abnormal heartbeats. It usually takes several hours to recover from a cardiac catheterization. After your procedure is finished, you'll be taken to a recovery room while the anesthesia wears off. This usually takes about an hour. You'll be able to eat and drink after the procedure. The length of your stay in the hospital will depend on your condition. The following day you may resume light activity.